Hi, Dr. Todd Sullivan from Nova Chiropractic and Acupuncture. One common question I get from patients is, what do you think of an inversion table? So an inversion table is just similar to this, which is a spinal decompression table. It's really great at stretching out the lower back and taking the pressure off that area if you're dealing with a herniated or bulging disc or even sciatica in your lower back. There are some differences though between like a spinal decompression table and an inversion table, so there's some pros and cons that we'll go over and explain how that's going to be different from like a spinal decompression table. So with a standard spinal decompression table, what's going to happen is the table is going to tilt back to help concentrate the stretch in your lower back, and then there's also going to be some straps that we put around the abdominal area. And what's going to happen is the table is going to separate right underneath where her problem is in her low back. And that's going to help to concentrate the stretch there and decompress the spine and take the pressure off the nerves in that section. Now, an inversion table will do something very similar. It will essentially stretch out the lower back, but the difference is it's going to be pulling from your ankles or your knees. And if you have an issue in one of those joints or even your hip, that can cause some irritation, because when you go inverted, all that pressure is being placed on that joint that could be already irritated from some, say, arthritis or some other condition like that. So sometimes people that buy an inversion table will use it, and then they'll realize that it's actually causing more discomfort in other areas, even though it may be helping out their lower back. So you just have to be careful with that if you have an issue in your ankle, knee, or hip. The second issue with inversion tables is, as opposed to the decompression table, the decompression table is going to gently stretch for 45 seconds and then relax for 30. And it does this for about 15 minutes. And what that does is it helps to open up that space where the nerves come out. It also helps to get a little bit of movement of fluid in that area and help to pump out any inflammatory products in that area. So that's the optimal way to kind of decompress your lower back, is to stretch for 45 seconds and then relax for 30. Well, with an inversion table, you're going to be going inverted, and unless you keep flipping back up, every 30 to 45 seconds, you're not going to get that back and forth motion. And so you may not get as much of a relief as you would with like a spinal decompression table. The other issue with that inversion table is when you're inverted like that, you're going to get a lot of blood flow and stress on your head, and all the blood's going to rush down to your head. And so if you have eye issues, it can also cause irritation to those. So you have to be really careful and get cleared by your medical doctor before you use an inversion table if you have a condition that could be affected by it. So that's one of the main cons to the inversion table, but they honestly are a great at-home treatment option. It will definitely decompress your lower back and take the pressure off that. The other nice thing with an inversion table is you can also control how far you go inverted. So if you don't feel comfortable with it, you can start off at a really slight incline and then go and increase that incline to get more of a decompression effect. And again, obviously you having it at home is a great thing, because you can just, reverse that 8 hours of sitting you just did by just laying on that and decompressing your spine there. So it's a good at-home option, but ideally you'd be able to try it before you use it to see how your body handles it and see if you like that type of feeling. But overall, we have a lot of patients that will use that. Obviously, the best option is like something we have in the office, where it's going to be a computer-controlled decompression unit, but an inversion table is a good option. So I hope that answers a common question I get, is what do I think about inversion tables? If you have any questions, reach out to me at 703-912-7822 or schedule online at novachirowellness.com.